Hello, and welcome to this week's episode of Ask Dr. Murphy. Happy Thanksgiving to those who celebrate. I hope everyone is doing well today. My name is Katie Berg, and I'm a research study coordinator with the Havey Institute for Global Health. I'll be leading today's discussion. First, I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you today?
I'm doing just great. Thank you, Katie.
Dr. Murphy is the Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week here on Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines and U.S. COVID statistics through today, November 22nd. As always, we invite you to submit any questions you have down below via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Starting with the updated U.S. COVID statistics, average new hospitalizations per day are 2,319, average COVID deaths per day are 78, and the new vaccine uptake is 14.8% for U.S. adults and 5.4% for children. Dr. Murphy, your reactions to those numbers?
Well, what's happening now is we are starting to see upticks in COVID. In Chicago in particular, the COVID hospitalization rate increased last week by 17%, with 384 hospitalizations. Now, that's definitely different. Something's happening. But compared to 2022, it's still much lower, about 50% lower. So it's going in the wrong direction, but it's still better than the year before. So overall, the hospitals are not overwhelmed with COVID cases, but they are coming in. It's just very unfortunate that, before Thanksgiving, we expect this to really pop up after Thanksgiving when people are all moving around and spreading these respiratory infections, and it's happening before. So we should see a pretty big uptick after the holiday.
Mm-hmm. And there was news this week related to COVID on who made up the most of those COVID hospitalizations this year specifically. Can you tell us about that?
Yeah, so there's two things. One is that it's the 65 and over group that is really at risk, and that continues to be the case. So, over 2/3 of all the hospitalizations, and this is regardless of the underlying diseases that the people have or whatever. So you look at hospitalizations, you look at more than half of ICU admissions are over 65, and 90% of deaths are people over 65. And this has just been true all along. Now you dig down and look at that a little more, and you find that most of these older patients had at least one underlying condition that put them at risk, some cardiac disease or cancer, something like that. But the majority had actually two or more of these underlying conditions. So it just points out who is really mostly at risk for getting seriously ill. So we need to focus our public health efforts on the groups that are much more at risk. Sadly, it looks like that 75% of older adults that are hospitalized this year never even received the bivalent vaccine. That was the vaccine that came out in 2022. It had a mixture of the Omicron and new variants and the old Wuhan virus. The vaccine that came out in September of this year is a completely new vaccine. So if you start breaking down who's getting really sick, even in this older crowd with underlying diseases, it's the people that are not keeping up with the vaccinations. So it just highlights how important keeping up to date with your vaccines. So even if you didn't get the bivalent vaccine, forget it, get the new one now. And that will help you, particularly if you're in a high-risk group.
Absolutely, it will. And moving on to another disease that is having an uptick again in this season, the flu has now been reported as high in several states. Can you tell us a little bit about that?
Yeah, flu comes on the strongest starting in December, but we're seeing right now in 7 states that the number of cases is really soaring. So it's Alabama, Florida, Georgia, Mississippi, New Mexico, and South Carolina have declared high activity of flu. Moderate activity, New York City, California, New Jersey, Texas. So it's happening a little early. And so the same thing with COVID, we expect to see after the holidays, after people have been moving around, and we expect a huge amount of human movement during this Thanksgiving week. People just traveling like crazy. And that's going to, of course, spread these diseases. And we'll see the same thing with flu. Now, flu vaccine uptake has been better than COVID vaccine. People are used to the flu vaccine. The flu vaccine is a new vaccine every year. It's not a booster, it's a new vaccine. 35% of children and 36.3% of adults, including 59.5, almost 60% of people over 65 have taken the vaccine. So the uptake of the vaccine is much, much higher than with COVID. And often this happens institutionally, like in nursing homes and assisted living places, many congregate settings, like working in the hospital. We have to have documented flu vaccine by December 1st. So most people have already had it. After that, we're not allowed in the hospital without having the vaccine. So that really helps. So, and that will help also with the current flu pandemic. So make sure you get the two. Now, you can get the flu vaccine and the new COVID vaccine at the same time. There is some increased risk in older people. Now, older people get a dose that's 4 times higher than younger people. Over 65 gets 4 times the dose. And there was some problems giving COVID vaccine and the flu vaccine at the same time. It's still allowed, but there are more side effects with it. So a lot of people do spread those out by a week or two until a person feels well and then take the other vaccine. So far this fall, the CDC estimates at least 780,000 flu illnesses and 8,000 hospitalizations, at least 490 flu-related deaths, including 1 child. Flu is recommended for everybody 6 months and older. So get out there, get your flu vaccine as well as your COVID vaccine. And remember, there's also treatment for both of these diseases. There's treatment for COVID and there's treatment for flu for children and for adults.
Absolutely. And those were things we didn't have earlier on in the pandemic that have helped mitigate the number of losses that we've seen now.
Yeah, and
sure.
the thing is, the medication works whether you had the vaccine or not. So, if you didn't happen to get a chance to have the vaccine, you can get treated if you come down with it. It's very easy to make the diagnosis of flu as well as COVID right now. So get diagnosed, get treated.
Absolutely. And the third respiratory illness that we have been speaking a lot about in this season is RSV. Specifically today, there have been reports about the monoclonal antibody RSV injection for children and some hurdles in distributing that treatment. Can you talk to us about that?
Well, it's a new vaccine being distributed by Sanofi, and it's actually a drug. It's not a vaccine. So, as you mentioned, and I think they completely underestimated how well this was going to be accepted by the population. It's specifically for very young children, under a year old, up to 2 years, if they've got some underlying conditions. The drug works very well. It prevents you from getting respiratory syncytial virus, or RSV, which is the top cause of infant hospitalization in the United States, leading to 1 to 3% of children under 12 months of age being hospitalized each year. So if you remember last year, the pediatric hospital beds were full of people with RSV. So this year, mothers and fathers they're very concerned with these young babies that they're going to get this thing, and they want this drug, which is called Beyfortus. And they've been working with the company to see how many more doses they can get released. And supposedly another 70, 80,000 doses are going out on the market soon. If you have a kid in the age range to get this, you need to look around and see if you can find treatment for this at this particular time. Good luck.
Absolutely. We hope that that will become more available and very quickly. And speaking of vaccine availability worldwide, globally, measles again has begun to climb globally. Can you break that down for us?
Yeah, so just like RSV, measles is actually one of the most contagious diseases in the world. And with RSV, by the way, for adults over 60, there is a vaccine available. And you may have seen it on commercial advertisements. It's being massively advertised to take for people over 60. And that uptake is still only about 14%. But so that's yet another vaccine to put on your list of things that you want to be taking. But back to measles, like you said, there's a big, big increase worldwide in measles, including in the United States. So in 2022, last year, over 9 million cases occurred, which resulted in 136,000 deaths. Measles can kill you. People don't they think, oh, measles, you just get a rash and whatever, but it can cause death. So and it's so contagious. And if you don't have the vaccine, which works terrific, by the way, 97%, 98% effective. So if you have the measles vaccine, you just don't get measles, and you don't have to keep getting boosters all your life either. You just have the 2 shots and then you're done. So the vaccine is really highly effective with measles. But around the world, especially in lower resource settings, they don't have enough of the vaccine. And that's why this thing keeps spreading. So it's thought that 74% of people in the world are fully vaccinated. Now, to stop the pandemic of measles, you have to have over 95% of people vaccinated. It's so contagious. So it can be very disruptive. People can get very sick. In 2021, 22 countries reported outbreaks, and last year, 37 countries reported outbreaks. So a big, big increase. And that may have been due to the disruption and all the supply chain and everything due to COVID. So keep up to date with your measles vaccine as well. It's highly effective, and it's one of the most used vaccines in the world, and really works really quite well. So as far as it goes, this year, 41 cases have been reported nationwide. So we're talking, really a small amount, but this doesn't go away if you don't. It's so contagious, and so please make sure you're up to date, your kids and adults if you never happen to have it, because it's very, very easy to transmit once it gets in the population if 95% of the people have not been vaccinated.
Absolutely. Certainly a global goal to push towards that. But finishing out our story today, unfortunately, another disease that has been causing a lot of issues globally, and specifically in Zimbabwe, there has been quite a large outbreak of cholera. Can you tell us about that, and also just about cholera's burden in general?
Cholera causes this terrible diarrhea, and can cause death. Since February this year, there were 150 suspected deaths from cholera in Zimbabwe alone, which is a country of only 15 million people in southeastern Africa. They had more than 500 cases per day since October. So it's a really, really big problem when this thing gets a hold. It's a waterborne disease. It's spread by contaminated food or water. And it can be deadly. You can actually just literally die from diarrhea, from dehydration and lack of fluids in your system. And if there's anything wrong with you to begin with, any underlying diseases, that even makes you more susceptible to severe outcomes. And the current outbreak is spreading from urban to rural areas and has been confirmed countrywide in all 10 of the provinces there. So it's very unfortunate for these people in that particular country, and WHO is trying to provide or direct resources to treat those cases and try to cut those cases down. WHO reported 472,000 cases of cholera in 2022. That was double the amount from 2021. And so far in 2023, we're not done with 2023 yet, it's 723,000 cases. So over the last 2 years, it's doubled every year. So this is a bad sign. So it's just yet another thing we worry about. Particularly if you're in a low and middle income settings. And I know a lot of people who watch this podcast are from low and middle income countries. So, it's something we really have to be on top of because it can be so deadly.
Absolutely. And a somber note to end on, but thank you very much, Dr. Murphy, for your time and expertise breaking down these reports and outbreak data for us. It's much appreciated.
Well, great. And have a great Thanksgiving. And we'll see you next week.
Absolutely. Have a great Thanksgiving, everyone. And please submit any questions you have down below. Thank you.